Hi, my name is Christina, and this is Holly.
Hi.
And we're here to talk to you guys about the peak flow meter. The peak flow meter is used by patients with mild to moderate asthma. The purpose of the peak flow meter is to measure the peak expiratory flow rate. Say that fast 3 times. It basically measures the fastest speed which a person can blow air out of the lungs. It kind of gives the patient an indication of how well they're breathing. It's often used in conjunction with an asthma management plan that also has a metered dose inhaler as well as a spacer for medication administration. The peak flow meter, the first thing that you have to do with this is you have to set a baseline. In order to set the baseline, the patient's going to use this at the same time of the morning and the same time of the evening every day for about 2 weeks. And they're going to do this during a period when the patient has their asthma under good control. They're not exhibiting any symptoms or having any difficulties breathing. Once they get that baseline set, and for today's purposes, Holly's baseline was 400. That was the highest number that she blew in that 2-week period. What we have to do from there is determine 3 different zones. The green zone, which means that her asthma is well controlled and she doesn't need any treatment. The yellow zone, which means that her lung function isn't as good and she does need to follow her personal asthma care plan. And generally that involves medication through the use of a metered dose inhaler. And then there's the red zone. If she blows into this and ends up in the red zone, she will need to follow her personal asthma action plan and then also contact medical emergency personnel as quickly as possible. So, Holly, are you ready to demonstrate this fabulous piece of equipment today?
Sure. I'm going to stand up for this.
So the first thing Holly's going to do is she's going to make sure that the sliding indicator is at the bottom of the scale, which is, of course, down toward the low numbers. She is going to hold the peak flow meter so that her fingers don't block the outlet opening or prevent that sliding indicator from moving the full length of the scale. It's best to grasp the meter around the round handle of the device. So while Holly is standing, she's going to inhale as deeply as possible and then place her mouth firmly around the mouthpiece, making sure that her lips form a tight seal and the mouthpiece is inserted past her teeth. Then Holly's going to blow out as hard and fast as possible. It needs to be a short, sharp blast. This will cause that indicator to move up the scale. And it's important to note that you don't have to expel all the air in your lungs. The indicator will most likely not move after the first few seconds of effort. The final position on the indicator is the peak expiratory flow rate. The patient is going to want to make note of this value. They're going to repeat those steps 2 additional times, allowing a little bit of a rest in between each time, approximately a minute. The variation between the 3 readings should not exceed 10%.
And my last attempt. Okay.
Holly's going to record the highest of the 3 readings in her peak expiratory flow rate readings log. She's not going to average it. Along with her rating, she's going to want to go ahead and record any type of symptoms that she might be having, along, of course, with the date and time. She's going to go ahead and compare that result, her highest result, with her personal best result, which, of course, was 400. And then she's going to calculate the percentage to find out where she falls. In this case, we've gone ahead and marked the peak flow meter. So the stickers indicate anything above 80% of 400, which is 320, as in the green zone. Anything that's 50% to 79% of her peak flow rate as the yellow zone, and anything less than 50% of her personal best is in the red zone.
Okay, for the purpose of this, we're going to say that my highest measurement was 300, which would put me in the yellow zone. So we're going to take action according to my asthma control plan.
According to Holly's asthma control plan, she's going to use her metered dose inhaler, and she's going to take 2 hits of albuterol. The first thing she's going to want to do, because this is a new inhaler, is she's going to need to prime it.
So in case you don't know, you just stick that in there first. And then you shake it, and then puff until you have a good flow.
Just make sure you, as you're priming it, hold the inhaler as your arm is extended so that it's away from your face.
Okay.
Then she's going to, in this case, use a spacer. She's going to take the cap off the inhaler and insert it into the spacer. And with this spacer, the instructions say to go ahead and insert, take off the protective cap, and then shake the spacer. This particular spacer has a built-in mechanism so that if you inhale too quickly, it will make a noise. So Holly's going to want to put a puff into the chamber, or put the yes, into your mouth, the spacer into her mouth, and then put a puff into the chamber and inhale slowly. Hold it for approximately 8 to 10 seconds, and then exhale. Holly's personal asthma control plan calls for 2 puffs, so she'll want to wait 1 minute in between puffs.
And we'll say that's a minute.
And exhale, yay. All right, if for some reason you don't have the spacer, there are 2 different methods for which you can use the inhaler without it. There's what's known as the closed mouth method, which most people are familiar with, which is where you place the inhaler directly into your mouth. However, the problem with this method is that the majority of the medication ends up at the back of your throat instead of in your lungs. So the open mouth method is more highly recommended, as it's more effective. Holly's going to demonstrate the open mouth method. To use it, you'll want to open your mouth widely, or have the patient open their mouth widely, and hold the inhaler 2 finger widths away from the lips. Dispense the medication, and then breathe in slowly. Hold it for 8 to 10 seconds, and then of course exhale. And wait a minute and repeat the process. I think that concludes our demonstration.
Yes, just remember for priming, if you haven't used the inhaler for a while, you need to prime it, and if it's a new one, you need to prime it. Other than that, thanks for watching our video.
Hope you enjoyed it.